All right, it's that time. Thank you guys again for joining us today for the role of home care for people with Parkinson's. My name is Annie Long, and I'm a Senior Community Program Manager with the Parkinson's Foundation. I'm very excited to bring you this program today in collaboration with Vanderbilt University Medical Center, one of our centers of excellence, as well as Vanderbilt Home Care. So before we get started today, I just want to make a few preliminary announcements. As I mentioned earlier, all of you guys will be on mute during today's program. This is just to eliminate any background noise and echo, but please feel free to join us on camera. I want to take a moment to thank our sponsor of today's program, Amneal. It is, undoubtedly because of the support of our program sponsors that we're able to do these things and able to offer resources to the community. So thank you so much, Amneal. We'll put the link to our chapter supporters page in the chat. So if you guys want to check out our other Tennessee, Kentucky chapter supporters, please feel free to do so. All right, at the Parkinson's Foundation, our mission is really to make life better for people with Parkinson's. And we do that through focusing on expert care. And you'll hear more about expert care today. We also focus on research, so that there is a tomorrow ideally without Parkinson's. So one of the things the Parkinson's Foundation really focuses on is making sure that we're supporting patients and families by providing free resources. So we have lots of free resources. We have educational books, webinars, programs just like this one. We also have a toll-free helpline that is available to answer any questions that you might have regarding Parkinson's symptoms, treatment. So definitely check out our toll-free helpline. Krista will put that in the chat for you, but our toll-free helpline is 1-800-4PD-INFO. And again, that line is staffed by nurses and social workers Monday through Friday. So please feel free to call them anytime you have questions or visit our website at parkinson.org. So I wanted to share really briefly an exciting new initiative that we have going on at the Parkinson's Foundation. And this is PD Generation, Mapping the Future of Parkinson's Disease. So the foundation, in partnership with some of our centers of excellence around the country, we are now able to offer free genetic testing and counseling for Parkinson's related genes. Obviously, in the midst of COVID, we've pivoted slightly where we're now offering telemedicine appointments for our genetics initiative. So feel free to visit our website, parkinson.org/pdgeneration, to get more information, watch a video, and then sign up to participate. Ideally, most of you have also joined us for one of our virtual programs through our PD Health at Home virtual program series. So every Monday, Wednesday, and Friday, the Parkinson's Foundation offers really amazing programs. Every Monday, we focus on mindfulness, reducing stress. Wednesdays, you'll hear from expert speakers. And then Fridays, we focus on fitness. So please visit our site at parkinson.org/pdhealth to learn more about upcoming virtual programs and to listen to archived recordings. And today, in fact, we are actually partnering with AARP on a webinar right after this one. So if you're not zoomed out, we'd love to have you join us for that webinar. It will focus on fall prevention and living safely at home with Parkinson's. So I think it's a great program to follow the one that we're going to be covering today, which is, focusing on home care. And connect with us locally. So in addition to a toll-free national helpline, the Parkinson's Foundation also has a Tennessee, Kentucky chapter. You can reach out to our local chapter for information on local referrals, upcoming programs just like this one, as well as to get connected with others in your community. All right, and again, this is our website, parkinson.org. It's a wonderful resource, as well as our toll-free helpline. You can visit our website to order free resources, books, again, sign up for webinars. We even have a community forum that you can join as well if you want to ask questions of our doctors and of fellow community members. All right, so without further ado, it's now my pleasure to introduce our first speaker today, Jessica Stroh. Jessica obtained her nursing degree from Tennessee State University. She became a movement disorders nurse in 2007, a case manager for movement disorders in 2013, and a movement disorders nurse coordinator in 2020. She specializes in deep brain stimulation and management of Parkinson's disease and other movement disorders. Jessica obtained a healthcare dementia certification in 2018, and her research interests are focused on improving patient outcomes after deep brain stimulation surgery and improving quality of life for those living with Parkinson's. So without further ado, Jessica, take it away.
Good morning, everyone. Thank you so much for joining us today. I could not be happier to be making the introduction to this talk about home health care. As the nurse coordinator for movement disorders, I set up home health care for patients daily, and I see the extreme value of bringing talented home health providers into the home environment to provide hands-on in-home education and training. I'm so excited for you to meet these wonderful people today and hear what they have to teach us. Also, we would like to find out a little bit about all of you. We have a polling question that's about to come up. Have you ever used home care services? Please participate and let us know. Thank you. So looks like a lot of you have not, so this should be a very helpful presentation for you. First up, I have the privilege of introducing Kailee Kell, our physical therapy assistant. She's going to take it away and teach us all a little something today.
Yes, thanks so much, Jessica. Like she had mentioned, my name's Kailee Kell. I am a physical therapist assistant with Vanderbilt Home Care. I'm also a licensed massage therapist and LSVT Big certified clinician. I've been serving the home care PD community for about 4 years now in the Nashville area, and we are so excited to be with y'all today to discuss the role of home care in the treatment of patients with Parkinson's disease. So we're just going to get started. I wanted to give you guys a little bit of a background about our agency, Vanderbilt Home Care. We have been providing services for over 34 years now under the Vanderbilt umbrella, serving the greater Nashville and Davidson counties, as well as the 6 surrounding counties in the Middle Tennessee area, as you can see from that map there. Just some fun facts, our clinicians on average drive over 85,000 miles every month and do treat about 750 patients every day in those counties. Our agency has both private duty and intermittent teams. Our private duty team is utilized more in our pediatric population. So for today, we'll be focusing more on education regarding our intermittent teams that serve and provide care for our Parkinson's disease patients. So a little bit more about our intermittent home care team. Our clinical team is interdisciplinary. It includes skilled nursing, physical therapy, occupational therapy, speech therapists, medical social workers, as well as home health aides. So these clinicians are specially trained to care for what would be considered the more medically fragile population within their home environment. Our treatment visits range between 40 and 45 and 60 minutes, just depending on our patient's tolerance levels, as well as what our treatment goals are. And these visits are conducted either monthly, weekly, or multiple times a week. The majority of our therapy visits, like OT, PT, speech, are going to be conducted at least 1 to 2 times a week for our Parkinson's disease patients. Now we'll be discussing what patients are eligible for home care services. So to qualify for and for insurance to cover home care services, 2 things must be met. You must be homebound and have skilled need. So some private insurances will have a visit limitation as long as these 2 things are met, as well as more services like Medicare Part A, they'll cover home care services, again, as long as the patient's homebound and there's a skilled need. So what does homebound mean? To be considered homebound, you must either be determined by your doctor to be medically contraindicated to leave the home. This could be because of immunosuppressant precautions or you being of high risk of infection. Or our patients are deemed unsafe to leave the home due to significant mobility deficits, which we do see frequently in the Parkinson's community. They could require use of an assistive device or multiple devices, or require the assistance of a caregiver to leave the home safely for medical necessary appointments. You must demonstrate considerable taxing effort to leave the home to the point where leaving the home unassisted is unsafe for the patient. Again, there must just be a normal inability to leave the home frequently and safely. To put that into perspective, we often evaluate patients who report that they're able to leave the home to participate in maybe other PD related exercise programs like rock steady boxing. They're able to visit their family still, go to their grandchildren's sports games, go to lunch with friends, which we totally love for you. Our goal is to help the PD community maintain that ability to perform those important tasks just for quality of life. However, if you are able to leave the home to participate in events like that, you likely won't qualify for home care services, and we would work with you and maybe possibly recommending some outpatient therapy services. So in addition to being homebound, the other requirement is that there is a skilled need. So this means that there's a specific reason or need that requires a skilled clinician to come out to evaluate and establish a treatment plan related to that skilled need, which I'll go over a little bit more in the next slide. So some examples of skilled need are outlined in this slide. The first one being someone eligible for home care services might have received a new medical diagnosis or a change in their medical healthcare regimen or medications that warrants us coming out to evaluate. Often our patients are referred from either a recent hospital stay or inpatient rehab stay. And now after being discharged, they demonstrate a level of deconditioning or a form of decrease in function that warrants skilled care be provided in the home after that inpatient stay. We also could just receive a referral from the doctor from a community doctor's visit, whether that be with your primary care doctor or your neurologist, who while you're at that visit, that doctor recognized or identified that there is a change in your functional ability or mobility or a safety concern in the home. And that would warrant us coming out and receiving a referral to come see you. And again, our patients must have that skilled need for care that is specific to function in the home environment. So this is a diagram we thought that might be helpful to give you a little visual as to where home care lies regarding rehab progression. As you can see, we're considered what would be the middleman between either higher levels of care like you would receive at the hospital, bridging the gap to eventual progression to either an outpatient therapy program or after we discharge to a self-care program in the home. So first, I'm going to go over some more general benefits of home care services. Then a couple slides later, I'm going to go over some home care benefits specific for our Parkinson's population. The first general benefit of home care is that we are providing a continuum of care. So oftentimes after a recent hospital stay or even a really lengthy doctor's visit where our patients are receiving very detailed discharge instructions or changes in their medications, it can be really overwhelming and hard to absorb right out of the gate. So a benefit of home care is that we're there in the home to help continue that guidance. We're going to be able to provide continued education about the disease process, about your medication changes. We'll be assessing and documenting your vital signs each visit to ensure that you're maintaining safe values and really ensuring that you're able to thrive and function safely now that you're home, after these recent changes. So because of that continuum of care, our goal is to keep you out of the hospital and decrease any risk of hospital readmission. So personally, we pride ourselves at Vanderbilt Home Care in having an only 6% readmission hospital rate, which is 9% less than the hospital average, or the national average, sorry. So again, our goal is to keep you out of the hospital and safe in the home. And then lastly, home care can also help decrease the risk of hospital-related infections. So especially during this COVID-19 pandemic, our clinicians' goal is to keep you safe, free of any infection or anything you might be exposed to if you were receiving care in more of an inpatient setting. So speaking of COVID-19, what precautions are we taking to ensure that that safety is being maintained in the home? So again, our top priority is going to be making sure not only our clinicians are safe, but our patients are as well. We personally follow these standards outlined by Vanderbilt University Medical Center, as well as those established by the CDC. So what we do while we're in the home and before we even come see you, we make sure that all our employees are equipped to make sure they are in the home wearing masks, eye protection, gloves while providing care. Our employees go through daily screening regimens before we're allowed to even report to work. This includes temperature checks as well as detailed screening for symptoms. While in the home between visits, our clinicians are very frequently washing their hands, sanitizing all supplies used. Any equipment we bring into your home to try with you is going to be thoroughly cleaned, as well as any of our treatment bags. We're making sure that those are sanitized between visits. And again, personally, our home care agency, we do follow Vanderbilt's visitor standards and regulations. So we do require any patient or caregiver present to wear a face mask while we're in the home. Each visit, our families and patients are going to be screened via temperature checks, as well as detailed questions about any symptoms they might be presenting with. Our clinicians will call you the night before or the morning of to ask you those questions before we enter the home. Another step we take to ensure we're adhering to Vanderbilt's visitor policy is we're only allowing one person or caregiver to be present in the room during our sessions, again, to protect our patients as well as to protect our employees themselves. So now we wanted to discuss with you some benefits of home care specific for Parkinson's disease patients. The first one being, this is one of my favorite things about home care, is that your family members are able to be directly involved in each of your sessions. Since we're coming to your home, they're going to be there alongside you, receiving the same education and instruction that we're giving to our patients. And this really helps improve kind of carryover and effectiveness of our treatments as well. Each session is going to be performed on a 1-to-1 ratio. So you're going to have our undivided attention with very minimal distractions while we're in the home. You will be our sole focus of that session. As discussed in previous slides, the home is the safest setting to provide skilled care, especially to those who are considered medically fragile and have significant functional impairments like frequent falls or difficulty with freezing gait or rigidity. That's something that we're going to be able to address in the home safely. While we're in the home, we're going to be able to tailor our programs, provide different training and exercises and activities that are directly tailored and adjusted to your specific home living environment. Any sort of functional impairments that you're having, whether it be getting in and out of the shower, in and out of bed, on and off the toilet, those are things we're going to be able to work with you in real time in your home, in your actual shower, your actual bed, which really just helps fix functional mobility and training efficiency. We do have a multidisciplinary approach, meaning that we have access to many different disciplines like skilled nurses, home health aides, and social workers if we determine that is a need for you and your family and caregivers. And once we've met our established home care goals while we're in the home, we'll be able to, again, help bridge that gap to help you progress to a different level of care, whether that be outpatient or self-care. Again, since home care is an intermittent and temporary service, we will be striving to improve function in the home to progress towards transitioning to that outpatient program or self-care. For us, it's a very exciting and fulfilling moment when we can help a patient gain some independence and no longer meet homebound requirements. When that happens, we're happy to communicate to your doctor and initiate the referral process and transition to outpatient. So this ends my portion of the presentation. Thank you for lending me your ear. I'm now going to pass the mic over to my colleague, Rebecca Zender, who is one of our awesome speech language pathologists.
Okay, hello everyone. Thanks, Kaylee. That was great. Again, my name is Rebecca Zender and I'm a speech therapist at Vanderbilt Home Care. I have been there for about 3.5 years. Prior to becoming a speech therapist, I got my first master's in clinical psychology, and I'm also a licensed professional counselor. So if you work with me, and I hope you do, you'll get a 2-for-1 special. So let me get into it. Again, Vanderbilt Home Care provides nursing, social work, speech, occupational therapy, physical therapy, and home health aid services. All of these disciplines coordinate care and work together to make sure that we're providing specific patient-centered care. We also communicate with your physician and medical team to ensure that they're up to date with your progress. So we offer nursing services as needed for our patients with Parkinson's. They provide care and education for PICC and port and central lines, wound dressing and management, alternative feeding education and management, trach care and education. They can also provide lab draws and urine catches in the home, and disease and medication management and education, which is especially valuable for those complicated medication schedules. Vanderbilt Home Care also has wound certified nurses, and we have behavioral health nurses as well. So up to 50% of people with Parkinson's disease experience some form of depression and anxiety over the course of their disease. The physical, cognitive, and emotional symptoms of Parkinson's are directly related to diminished quality of life and sense of self. Frustration, embarrassment, and social isolation are known consequences of diminished function and untreated symptoms. Additionally, those who take care of patients with Parkinson's experience considerable caregiver burden and stress. Vanderbilt Home Care offers social work services to provide that emotional support, as well as partner in developing a long-term plan of care and establishing available resources. And if you work with me, you get a little counseling in the middle of my therapy as well. So there you go. For the treatment of Parkinson's, the research demonstrates that medication and surgical treatment alone does not consistently and significantly improve overall function in Parkinson's, and that exercise is a very important key to Parkinson's management. As such, exercise is medicine. Engaging in speech, occupational therapy, physical therapy is part of your symptom management program, and you can get that from Vanderbilt Home Care. When looking into the need for speech therapy, I want everyone to know that speech therapists take care of everything above the shoulders. So swallowing, talking, and cognition. So let's talk about cognition. Cognitive dysfunction is one of the major clinical non-motor symptoms of Parkinson's disease. Between 40 and 80% of people with Parkinson's demonstrate moderate to severe cognitive deficits, which include difficulty with maintaining attention, simple and complex problem-solving skills, planning, sequencing, visual spatial skills, short-term memory, orientation, and initiating and maintaining conversation. Cognitive deficits can cause significant impairment, which keeps folks from living and functioning safely and can be a significant source of stress and caregiver burden. In speech therapy, patients with Parkinson's will receive an objective cognitive and communication assessment to determine the extent of deficits and a clinical interview to determine the impact these deficits have on their lives. From there, we'll develop a set of compensation strategies to target these deficits, which may include the use of external memory aids. We'll practice using these strategies that bolster short-term memory and attention. And I will also provide family members with cueing strategies that will help patients engage cognitively and be able to work through difficulties with communication. And importantly, we will work with the patient and their support system to determine what level of support or supervision is needed to maintain as much functional independence and safety as possible. Okay, more than 80% of patients with PD develop swallowing difficulty during the course of their disease. Swallowing impairment reduces quality of life, complicates medication intake, and leads to malnutrition and aspiration pneumonia. Listed here are some of the common symptoms of swallowing difficulty in patients with Parkinson's. And again, all of these difficulties can contribute to the development of aspiration pneumonia, which is life-threatening. Swallowing problems are first managed in speech therapy by an evaluation of swallowing function to determine weakness and aspiration risk. From there, the patient learns and practices swallowing exercises needed to strengthen the swallowing musculature and to protect the airway. A number of compensation strategies may be suggested, which can include posturing, speed of intake, eating tools that diminish aspiration risk, and the level of supervision needed during meals. Finally, you and I may determine a list of food items that are easiest and most risky to swallow. A combination of exercise, compensation strategies, and diet changes can significantly reduce aspiration risk. Okay, with regard to voice, over 89% of people with Parkinson's disease worldwide have speech and voice problems. And unfortunately, only 4% get treatment for it. Parkinson's disease patients typically have a low volume voice with a monotone or expressionless quality. Speech often comes in short bursts and inappropriate silences between words and long pauses before initiating speech. The speech can also be slurred and hard to understand. We know that the earlier a person with PD receives a baseline speech evaluation and speech therapy, the longer they can maintain communication skills as the disease progresses. The gold standard at this point for managing voice problems is the Lee Silverman Voice Program, and I'm an LSVT certified clinician. The exercise taught in LSVT have been proven to improve voice quality and loudness, articulation and speech, inflection, and overall intelligibility. In addition to these vocal benefits, LSVT exercises have also been proven to improve facial expression, swallowing safety, and breath support. The LSVT Loud program and its counterpart, the LSVT Big program, which is designed to target walking, balance, and flexibility, are intensive programs with 4 therapy visits completed in a week for 4 weeks plus homework. I have provided the full LSVT program several times in the past, and the benefits are clear. And as Kailee stated, I will note that for some of our folks in home care, this intensity can be too much, and I'm still able to provide the education and training in voice management fewer days a week as needed. So that's all I have to say. I look forward to answering any questions that you have and maybe meeting you in the future. Thank you.
Hey everybody, I'm Ginny. I'm a physical therapist with Vanderbilt Home Care, and today I'd like to introduce you to Vanderbilt Home Care Services occupational therapy and physical therapy programs and talk about the roles in treatment of patients with Parkinson's disease. And so first I'll start by introducing you to our awesome occupational therapy program. We have wonderful clinicians who span across all of those 7 counties that Kailee mentioned, and their main focus for the home setting is assessment and treatment of difficulties in performance of daily activities like home management and leisure activities, activities of personal care and self-feeding, all with a goal of keeping people safe
and active at home and facilitating lifelong well-being and physical habits. Some home management activities that our occupational therapists assess and treat are housekeeping activities, the ability to pay bills, using the telephone, laundry and cooking activities, and taking medications. So that means managing a medication schedule, but also being able to open and close pill bottles. Some examples of leisure activities would be being able to take walks around the block with family members, playing a musical instrument, singing, and handwriting a written letter. So our occupational therapists listen for cues that a patient is having difficulty performing those activities, sometimes to the point that the activity is avoided or there appears to be a loss of interest in those activities. Some red flags in performance of personal care activities would be difficulty performing any activity that relates to you, your body. And that means washing your body, dressing, having a fear of falling. And so you don't frequent the bathroom to do those activities. And again, just avoiding self-care activities. Sometimes we might just hear someone say subjectively that I can't do anything on days that I have to take a bath. So the bath might be exhausting. You take a bath and then the rest of the day you're in a chair or in bed because it's so exhausting. Some red flags with self-feeding are spilling food, spilling drink, having difficulty managing the food on the plate, not wanting to eat or drink around others because you feel like you're messy, or sometimes meals are skipped altogether. Sometimes people hide food. We've had a patient in the past who was feeding food to the dog because mealtime was just so stressful and inducing anxiety for that patient. Some problems that cause these red flags are weakness and fatigue, exhaustion, loss of balance or falls trying to perform the activities. Tremors can interfere, feeling like you're a slow mover, or you just have trouble keeping up with your family or friends or people you love. Poor coordination. Again, sometimes there's just a lack of support. So maybe you live alone and you don't have support from others to perform or complete those activities that you need to do. And again, sometimes there's just a lot of stress and anxiety, and sometimes that stress and anxiety can make the symptoms listed above worse. You know, your tremors could increase, your dyskinesia could increase. And so we help provide interventions to address that. Some activities that our occupational therapy team implements to help solve these problems are home safety assessments, and I'll talk more about that in a moment. But a home safety assessment typically includes a patient interview, assessment of the task being performed, assessment of the space where that activity is performed, and then provision of recommendations for adaptive equipment and for home modifications. They also incorporate fall prevention strategies, compensatory strategies, energy conservation strategies. We like for every patient that we see to have a home exercise program to address impairments, whether that be coordination or providing exercises that facilitate bigger movement patterns. Caregiver training is very, very important and kind of goes along with the last bullet on the slide, and that is simplification of activities, which is a team effort, but for a patient, the caregiver, the therapist. So working smarter and not harder, making activities the fewest steps as possible so that they're less taxing. I want to talk, before I go on to the next slide about physical therapy, I want to talk a little bit about examples of adaptive equipment and compensatory strategies. Adaptive equipment, examples of that are elevated commode seats, walking aids like walkers and canes, railings for beds or a hospital bed. Reaching tools we can train people in use of reaching tools in case their balance can be off and are at risk for falls with reaching, and bath chairs or bath benches. And then compensatory strategies would be items like for patients who have difficulty getting their food from their plate to their mouth, using weighted utensils to help with tremors or dyskinesias that could be contributing to that problem, using Velcro or magnetic fasteners instead of buttons to for clothing closure, and use of elastic shoelaces. And there's just a million compensatory strategies, and our teams work with patients and their families to find the exact right tool. Our physical therapy team works very closely with our speech therapists and our occupational therapists and focus on keeping people safe walking and moving around their home, and being safe with transfers, and working their hardest to put together a program for fall prevention for patients. So red flags to moving about the home would be repeated falls or nearly fall. We define a fall as any change in height, really. So it might be that you're standing and you fall back into your chair. It might be that you're walking down the hallway and you bump into the wall. It doesn't always mean a fall is you end up in the floor, but you end up being in one position, and because of loss of balance, you end up in a different position. We define that as a fall. Other red flags are you have difficulty keeping up with people you love. So you're being outwalked or can't get out of the chair as quickly as you want to. Sometimes people start to avoid walking or avoid transfers, and they are confined to a chair for much of the day because of that. We often hear a report if we go into a home and say, tell me what's going on, what is hard for you? An answer might be, I have a hard time getting up and down. We hear that a lot, or I have a hard time getting in and out of bed. Another red flag is that over time, you're needing more and more assistance from others. Some problems that are associated with that red flags list are weakness and fatigue. Also difficulty moving, whether that be you have freezing of movement or your movement patterns are small. So maybe you're walking and you have some shuffling of your feet when you're walking, or again, you aren't able to keep up, or you have trouble initiating movement. So typically, movement can be very spontaneous. It's just, not even a second thought to get up and move. And sometimes that can become more difficult. So it just becomes more of a challenge to initiate movement. Sometimes there's instability and fall risk or falls. So ways that we solve problems of movement and fall risk are, first, we definitely interview patients and their families to find out what's going on and find out those challenging tasks. And we assess risk of fall while people are performing that task. We have a multitude of standardized assessments that we use to help put a number to a fall risk. So almost like a rating of fall risk, to share with insurance companies and to show value of our programming. We, like our occupational therapy team, assess needs for equipment and provide training for that equipment. And then we can specifically address those challenging tasks to improve them. We can provide equipment trials and equipment training in the home, and work to simplify tasks, just like I mentioned in the occupational therapy slides, that keeping tasks simple. So we know that if you're walking and you're talking, your ability to walk and talk at 100% does not happen. Both of those tasks are affected by doing 2 tasks at one time. And we know that that can be even worse if you're trying to walk and chew gum, just kidding. But if you're trying to walk and carry a glass of water, or walk and carry your bottle of medications without spilling them, we know that it's better to do one task at a time. We do have LSVT trained clinicians in Vanderbilt Home Care, and we can apply sort of a modified LSVT program to our patients. We've already mentioned that the full program is a challenge sometimes for patients who are homebound. That's just, a lot of intensity, but we can definitely incorporate large amplitude movements into a home exercise program. We like for all of our patients to leave Vanderbilt Home Care with a home exercise program and a home walking program that will again promote lifelong well-being and physical activity. We've talked a lot about transition to outpatient programs after Vanderbilt Home Care, but sometimes our patients have goals that are, focused on other things like Rock City Boxing. I have evaluated a patient recently, and her goal was to transition from Vanderbilt Home Care to Rock City Boxing. So she wanted to get into an exercise program. So her transition program will be to be able to safely enter and exit her home, enter and exit a community program, and have the endurance to participate in an hour-long exercise class. So we've talked a little bit about home safety assessments and medical equipment assessments, and those are 2 things that almost every patient that our rehab team receives. Assessment of the home and being able to provide recommendations to improve safety results in an extended amount of time of well-being. So sometimes it can be a challenge to implement some of those recommendations just because of limitations of insurance funding. And so there are resources that our team can share. One resource local to Nashville is the United Cerebral Palsy Foundation. They have a chapter in an office here in Nashville, and they have an equipment loan program. So we help you access the application for that program and fill out the application of that program. We can provide you with details for the equipment that you need to be safer at home. And then you can take that application to UCP and let them know the equipment that you're looking for. So if your insurance has limitations to what it will fund, we can help provide resources for that equipment, and especially for those home modifications that might improve your safety at home. Again, we talked about LSVT Big and LSVT Loud, and 2 other specialized services that we can offer with Vanderbilt Home Care are mobility trials and mobility practice sessions using a U-step walker and wheelchair assessments in your home. I think I've gone over this slide pretty well. Home safety assessments result in recommendation of mobility aids or adaptive equipment, walkers, commode equipment, bath equipment, and home modifications. Recommendations result in things like grab bars in the bathroom, door hinges that will allow a bathroom door to be wider so it can better accommodate an assistive device, and always training for the use of equipment in those modifications that are recommended. So U-step trial or U-step walker trial. A U-step walker is a stabilizing walker that was designed to increase independence and eliminate falling for patients with neurological conditions. And so we'll focus the rest of this information about the U-Step walker towards Parkinson's disease. It is a walker that is covered by Medicare. It's the only neurological walker covered by Medicare, and we do have a demo. We have a demonstration U-Step walker that our clinicians can get and take to patients' homes who they feel like would be of benefit from the U-Step walker, and they can practice ambulation with that U-Step walker in their house. And then if it's decided that that walker will extend or improve functionality, then our team helps facilitate that approval process with Medicare, first by communicating with the doctor to obtain an order for the walker, and then just facilitating almost acting as a liaison between the patient and the equipment company to work towards approval of that device. We also have a wheelchair team working with home care patients who might need help moving more safely and at home, and sometimes that might be by sitting down. And so our team completes a thorough assessment, and then with that assessment and listening to a patient's and a family's goals and understanding what's most important about their mobility, develop a plan and recommendations for mobility. Our team collaborates. It's definitely a team effort. Wheelchair assessments and acquisition are a huge team effort, starting with the patient, but also including wheelchair suppliers and your doctor to work through the approval process for the wheelchair. Also, working with the patient once the wheelchair is obtained and learning how to use that wheelchair to the best that it can be used, and monitoring over time changes that need to be made with the wheelchair. So just because you get a wheelchair at home doesn't mean it's always going to be perfect, and our team can work to, I hesitate to use the word perfect, but making it as perfect for you as it can be. So I think that's all I have. Just wanting to reiterate that the focus of our occupational and physical therapy team are to keep you safe at home and helping you be safest and most efficient as you can be. And now I'm going to pass the conversation back to Kailee, and so she's going to give you information about how to refer to Vanderbilt Home Care.
Yes, thank you, Ginny. And thank you all so much again for giving us this time and this platform to speak with you about home care services for PD. We know it might not be the most thrilling and exciting topic to hear about for an hour, but it is something we're very passionate about and is such a huge benefit and service for our Parkinson's population. If you do feel like you would benefit from home care services, please reach out to your physician to discuss your needs and request a referral to be sent to a home care agency in your area. If you do live in the surrounding Nashville area, Vanderbilt Home Care would love to come see you. Our contact information is on the next slide. But if you don't live locally, you can go to Medicare's website and search for home care agencies near you. Insurance, just food for thought, insurance does require a face-to-face visit with your physician within 90 days of beginning home care services. So that's something you would have to address before receiving home care. And again, most insurances are accepted. It is covered by Medicare Part A without any out-of-pocket costs, but we always suggest you reach out to your specific insurance provider to determine what your coverage is. And our last slide here is just our contact information, our phone number, fax number, and our website. Again, if you live locally and you feel like you would benefit from home care, have your doctor reach out to us, and we would love nothing more than to come see you.
Thank you very much, Kailee, Rebecca, and Ginny. Now we're going to answer a few of the questions that our participants have submitted during the presentation. One of the first questions that I'm going to answer to get out of the way so that I can pick on our wonderful presenters after this is, do we think it's important to have a movement specialist? We really do. It's important to see a movement specialist at least once to confirm your diagnosis, to make sure that you actually have, the diagnosis that you think you do. We have had people come in who were told they had X problem, and they actually got to see the movement physician, and it turns out they had something else entirely. So it is a much more specialized field of neurology. And so if you live far away and it's not easy to get to a movement specialist, you don't have to follow with them only, but it's really nice to just get that confirmation and also make sure you have access to the most current disease management options and that you're being treated for the right condition. So thank you for that. Rebecca, we have a question for you on vital stim, swallowing issues, and speech therapy in the home environment. What are your suggestions or take on any of those?
Vanderbilt Home Care does not offer vital stim because we don't have access to the equipment in order to do it. I know that the intervention is designed to bring attention and sensation to the swallowing mechanism, and so you have more awareness of your swallowing and swallowing hard. So I know it can be beneficial for some folks. I do believe that Vanderbilt's outpatient program has vital stim. So if you want to pursue vital stim, then you can get it there. Otherwise, there are definitely strategies and exercises that we can work on in the home to target swallowing dysfunction for sure. Was there
Thank you.
That question?
That was perfect. Thank you.
Okay.
Kailee, here's one for you. Would you say that the level of intensity of therapy in the home is comparable to outpatient therapy, as beneficial, or does it depend on the patient's commitment to practice?
Patient participation is huge. Carryover when we're not in the home is a big thing we try to encourage. I would say for the most part, the patient population we treat, even though we're providing care in the home, it can be as intensive as we need it to be just based on their tolerance. Every patient's going to be different. We're going to tailor a program specific to you and specific to your needs. If you are able to safely leave the home, even if you're not driving, even if your family member is able to take you, you're not necessarily in need of an assistive device yet. You are able to kind of sit to stand independently and walk safely without assistance. We would generally recommend an outpatient program just because they're going to have more of the equipment to help you, whether that be machines or more space to be able to progress your program. But if you are having a hard time leaving the home, we could absolutely tailor a program to meet your needs that can be just as intensive as someone who participates in an outpatient program.
Thank you. Ginny, this next one is for you. Is there a specific suggested exercise regimen for Parkinson's disease, or do you recommend an initial physical therapy evaluation to determine kind of what comes next?
I do recommend a physical therapy evaluation just because the evaluation is patient specific, and it not only identifies impairments, but also the level of impairment. And then we can match an exercise program to those impairments appropriate to the level of the illness. And in this case, it's Parkinson's disease. So sometimes we might have to modify an exercise program depending on a patient's level of function. Sometimes it might be lying down in bed, or sometimes it might be sitting in a chair, but hopefully progressing to standing, but just making sure that it's safe and we set up the patient for success. So they're not only doing that home exercise program while they're our patient, but they do it forever, hopefully.
So this next question is really to kind of all of you together. Does physical therapy, occupational therapy, speech therapy, are the effects long lasting, or are they only long lasting if you keep doing the work?
Homework. Yes, we partner with all of our patients. They have to work harder than us. We are there to cheer you on, but yes, you have to engage in your therapy exercises every day to keep the train moving. Absolutely. You have to work very hard.
My mantra with Parkinson's disease patients is if you don't move it, you lose it. So our goal is to set you up on a program that you will be able to do daily, likely the rest of your life, just because exercise therapeutically is so important into not only maintaining your ability, but achieving more mobility as well.
Thank you. One of the questions was how do we find a reputable home health organization? And you guys very nicely covered that. Medicare.gov home health actually has the ability where you can put your zip code in, like was mentioned during the talk. If you're not sure how to do that, you can literally Google Medicare home health and it will bring you right to the right page. You can just click on it and it brings up all of the options kind of near where you live, and also some surveys that were filled out about the care received at those various home health agencies. So that information is public. You can also ask friends, relatives, neighbors, people who go to your, nobody goes anywhere right now, but when we used to go places, if you gathered, you could ask all of your people about, services they've received in the past. So how are we doing on time, Annie?
We're doing well. I wanted to just throw this question out there, Jessica. I don't know if it was on your list, but I think it's a really important one to cover.
Yeah.
So does being at higher risk for COVID complications make somebody eligible for home health care? I don't know if anybody wants to tackle that one.
I can answer that one. I think it can be part of the decision-making process in determining whether or not someone qualifies for home care services. So we do receive referrals that include risk for infection in the referral, but we're also looking at the big picture. There are safe ways to leave your home, and if you're leaving your home frequently, daily, then that interrupts your eligibility for home care services. So we're looking, it's part of our comprehensive assessment to determine homebound status. We do take risk into consideration, but we have to be true to your safety and ability to get out of the home frequently. And again, maybe it's an intermittent time that we provide you services. Maybe you qualify at the beginning, but with rehab, you get better and better, and our services would be intermittent. And again, we would facilitate that transition process so you can continue to get the improvements that you want.
So there were a couple of questions about finding home health care programs like this in other cities, and in other states. Every state has home health care. They just may not have the same home health care options that that we have in Davidson County, or even in Shelby County may be completely different than the options that are near you, which is why that Medicare website is helpful. Some really rural areas may be much more limited in what's available, but usually there's still something available. And if home health isn't available, then outpatient is certainly an option for people who live really far away from kind of any home care agency. We're going to have the answer to what is Medicare Part C, excuse me, in the chat, so that if anybody wants to check that out, that was one of the questions that was submitted. It'll be there for you to read. I had a few questions about how the caregiver stays kind of calm and strong. The Parkinson's Foundation has some great caregiver resources on their website. I actually encourage the caregivers to participate in the PD Health at Home program as well, because I'm doing it because it's great, because there's meditation and mindfulness and things that we really all need right now, no matter our medical situation. Respite care is helpful, but a lot of these things, really everything about the care that we provide right now is harder than it's ever been before because of the limitations given the COVID situation. So I can't imagine that is easy. We also had a question that kind of ties into that about counseling services available. one thing that COVID has done is highlighted the fact that there are virtual counseling services that exist now that maybe didn't make it onto our radar before because we had a lot of in-person choices. I encourage you to maybe search those options that exist, or even ask your primary care provider to see if they could connect you with one that they've used before or even heard positive feedback about. Annie, did I miss anything in the chat?
I did get one
No,
private question, if it's okay that I address that.
Sure.
Yeah, I got a question about Botox and if it can help with drooling, and if I've had any patients that have gotten Botox for drooling. I've had patients that have gotten Botox for drooling. For some of them, yes, it eliminated their drooling, and they felt pretty confident with the effect that it had. On the other side, Botox is temporary, so you have to get it every 3 to 4 months.
Yep.
And the way that Botox works on the salivary glands is that it prevents saliva from being produced. And the problem with that is really wicked dry mouth, which unfortunately can make it really hard to take pills and to be able to swallow. So it's kind of finding that balance. For folks that don't want to pursue that, I still work on drooling by talking about posture. A lot of my patients kind of have that forward stooped position. And if I do that for too long, it'll be like I'm sleeping in bed. I'll just be covered in drool. So we talk about, lifting that head up and keeping a good, strong posture, and then bringing more attention to that swallow. As that saliva is pooling in your mouth, we have to work on swallow, 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 being able to manage those secretions. So yes, Botox is an option for drooling, but there's also a lot of behavioral strategies that we can try as well. Thanks.
Thank you. So if we don't have any more questions, I just wanted to wrap everything up by thanking our program sponsor, Amneal, our fantastic presenters, and all of you who joined us for today's program. It's been a pleasure spending this time with you, and we hope to see you again at another program. As a reminder, if you'd like to join the Parkinson's Foundation for fall prevention and living safely at home with Parkinson's, you can register via the link in the chat. That program will begin shortly. Thanks again to everyone. Stay safe and have a happy holiday.